Good morning, afternoon or evening, everyone. Thank you very much for tuning into this, and thank you for the invitation to give this talk. It's my pleasure to spend the next 20 minutes or so talking about health-proofing our future and future-proofing our planet. So I'm aware that sounds very mysterious, so I'll share with you a brief outline. So I'm going to start by talking about trends in urbanization and trends in health inequalities as a way of setting the scene for where we are globally. Good morning, afternoon or evening, everyone. Thank you very much for tuning into this, and thank you for the invitation to give this talk. It's my pleasure to spend the next 20 minutes or so talking about health-proofing our future and future-proofing our planet. So I'm aware that sounds very mysterious, so I'll share with you a brief outline. So I'm going to start by talking about trends in urbanization and trends in health inequalities as a way of setting the scene for where we are globally. And then I will introduce the notion of health and resilience foresight as an important approach to bringing the future into the present and thinking more long-term about our human and planetary health. And then I'll end with some approaches from my research that I take to bring this future into the present. Okay. So first, if we start with urbanization and health today. Urbanization, this graph just shows from 2018's World Urbanization Prospects and shows how over a 50-year period from the year 2000 to 2050, the changes in the growth of urbanization in different parts of the world. And what we can see is that largely, whilst the North America and Europe and to some extent South America are quite urbanized, there's very little change happening expected over that 50-year period. By contrast, Asia, that's already quite highly urbanized, expects a huge amount of urbanization, and Africa is starting off from a lower baseline, but again, huge amounts of growth in urbanization. So put another way, this I find a really helpful map just to really contextualize that 50-year time frame on an hourly basis. So the numbers here are the hourly growth in the cities, so the number of people coming into the city per hour. The pluses are increasing populations in the cities, and the negatives are reducing city sizes. So you can see, you know, London, we have 10 people coming in per hour. Paris, we have 7. Berlin, we have 1. By comparison, Delhi, we have 75. Lagos, we have 56. So you can really see how much these cities are growing on an hourly scale. Why does this matter for health? Well, if we come to the health trends, or the disease trends rather, that we see across the world, this is essentially the death rates per 100,000 due to different diseases. So this is a global picture. We know that ischemic heart disease, so things that cause heart attacks, strokes, lower respiratory infections, pneumonias, for example, chronic obstructive pulmonary disease, these diseases account for a significant proportion of the death rates per 100,000 populations we see. If we break that up into the different income groups of the different countries, where normally you would expect that to be significantly different, right? So the dogma is that, you know, in rich countries we have those diseases, but in low-income countries we still have it's primarily infections. And what we can see, particularly in the context of lower middle and upper middle income, but to a significant extent in lower income countries as well, is this high contribution to not just infections, but strokes and ischemic heart disease, and this really burgeoning non-communicable disease epidemic we're seeing growing across the world. And this is important because a lot of these diseases are driven by exposures in our natural and built environments that are not conducive for health. So, for example, the risk of a stroke is associated with high blood pressure, is associated with how much salt you take in. So we know that environments like the food environment, your ability to be physically active, how much smoking and alcohol, those four risk factors contribute a vast proportion of the burden of disease, particularly for non-communicable diseases globally. Now, this is interesting from the perspective of cities because these are the very environments that are changing very rapidly. So really, we really need to start thinking about rethinking health and what we mean and how to protect health. And I argue that rethinking health should very much be intertwined with reimagining the urban. And this is why. We see these changes, you know, the first slide I showed you with the rapidly growing cities is not just the numbers, right? So the ways in which they're growing really matter. And so we know that in the most rapidly growing cities, we see this pushing of boundaries of human settlements that's disrupting ecology. We see a pattern of growth towards dense informal settlements that facilitates transmission of infectious diseases. We see a growing exposure to unhealthy environments, urban infrastructures are not coping with demands of waste and water, and importantly, which is particularly important for my future focused talk, increasing exposure to young people to these unhealthy cities. And lastly, we see this inequitable access to care. So where we have healthcare, this is inequitable, be that for treatment of existing disease or prevention of new diseases. Now, I'd like you to, for the rest of my talk, bear in mind these four different dimensions of inequality. So inequality with respect to exposure to these unhealthy environments, inequality with respect to susceptibility to disease in the first place, inequality with respect to access to care, and with respect to resilience. So why should we rethink? For a start, we know that many of the factors that influence health lie outside the healthcare sector. So this iceberg image illustrates this perfectly. So what we see at the top of, above the water, the tip of the iceberg, as it were, and that's what we see manifest in the healthcare setting, largely in the clinics and the hospitals, represents just a fraction of the factors below the iceberg that is driving this health, the disease profile that we see. Factors like education, housing, your work exposures, your food environment, your income, your built environment. These are all largely in the non-healthcare sector, but they contribute over 80% of factors that influence disease lie outside of this healthcare sector. Why else do we need to rethink? Well, we know that having this high and increasing burden of disease takes a huge toll on economic development. So this is an example of ambient air pollution and ambient and indoor household air pollution. In 2013, the estimated economic cost of premature deaths from air pollution in Africa was over $200 billion for ambient air and over $200 billion for indoor air. I mean, that is just phenomenal. So really, we can't afford to wait for diseases to occur to treat ourselves out of it. So we really need to get ahead of it and think ahead and think, how can we protect health, particularly in the context of young countries like those on the continent of Africa. And largely, we can't afford to continue with the siloed healthcare systems that are already overburdened and so largely focus on acute episodic care. So we wait for people to get ill and then we focus on improving their treatment. But really, I ask, how can we get below the tip of the iceberg and prevent disease from occurring in the first place and really create health? So that's another example, again, from air pollution, that we know that over 500,000 deaths are linked to polluted air in Africa. And yet we don't think about air as being a health system, right? So what are the implications of urbanization moving from just human health to planetary health? So I've used this triangle, which we normally use in the context of infectious diseases to depict the relationship between a pathogen, an environment, and the host, and how disease occurs. In this context, I'm using it to illustrate planetary health and the implications of urbanization. So if we take one side of the triangle, we know that the exposure to pathogens and pollutants like air pollution, as I just mentioned, and the environment, we know that the behavior of human beings affect the risk of emergence. So COVID is a perfect example of that. We know that disruption of ecology and pushing of human settlements disrupts those boundaries and increases the risk of zoonotic animal to human transmission of disease and emergence of new diseases. Similarly, we know that in the interaction between human beings and the environment, exposure to contagions, remember those dimensions of inequality I shared earlier, is influenced by how we interact with our environment. So whether we live in overcrowded areas, where the degree of biodiversity loss, the degree of our connectivity, either socially as a community or to information. And lastly, with respect to vulnerability, again, thinking about the dimensions of inequality, that interaction with us and any pathogens or pollutants is very much influenced by our environment. So whether or not we live in a food secure, healthy food secure setting really impacts our vulnerability on exposure to any of these pathogens. And we see this again in the context of COVID with an increased susceptibility in those who have obesity, who have diabetes, who have high blood pressure. So these are all factors of the environment that drive and increase the risk of these diseases. So I hope I've given a good rationale to convince you of the need to address the systemic drivers of preventable emergencies. And this is a really important thing to internalize, because whilst some emergencies are not preventable and the key action we can do is mitigate the impact, many are preventable with a long enough time frame to think about and to steer the ways that we structure our environments and our societies. And I say this because health does not trickle down from good intentions. And by that I mean we also inadvertently act as though if we just carry on and develop and build houses and build cities and have more people come into cities, that health will naturally follow. And we know that isn't true. We know that if we don't consciously think about how to protect and create health across all population groups, we end up with this widening of health inequality, even within urban areas, to a point at which some people in urban areas have worse health outcomes than those in rural areas, which you wouldn't expect because you'd think there'd be better health care access, for example, in urban areas. So really important to be deliberate with our approach to creating health. And so this is, I'm going to give you a warning of a complicated, messy diagram ahead, but it really is to illustrate what it would look like if we were thinking differently about what a health system is. So bearing in mind that the majority of factors that influence health outside the healthcare sector, if we think about what the systems for health would be in the context of cities, this is what we'd be confronted with, right? So if we look at some key bits of urban infrastructure, like energy, like land use, like water, like transport. So this is not intended to be exhaustive, but just to illustrate, we start to see how, if we fast forward here to the health and environmental challenges and emergencies that emerge. So we see this, we have an obesity pandemic across the world that we're not doing enough about. Obviously, new infections, COVID as a pandemic is something that's at the fore of everyone's minds at the point of recording this. So we can trace these backwards to see that actually, yes, healthcare systems play an important role in terms of how people seek healthcare and access healthcare to many of these diseases. Or in actual fact, a lot of the arrows here and a lot of the lines point to other exposures like air pollution, like social cohesion and connectedness of safe housing, and right up to different urban infrastructure. So you can start to see when I say, you know, human settlements comprise systems for health, you can start to see how that makes sense. And the lines here, by the way, are drawn from known associations. So we know that where you live, for example, is associated with your risk of injury or safety. So this is an even more whittled down system for health. So if we take out the human settlements and public space as a system for human and planetary health, we can start to say, well, if we wanted to address these health and environmental challenges, we would really need to be thinking differently about structuring how we develop human settlement and our shared blue, green, grey spaces, which I term here as social infrastructure, and how we can deliberately design these to reduce the risk of exposure to factors that undermine health. So this is just an example of how of a different approach to thinking about health when we start thinking towards the future. So that takes me onto this point of foresight, because, you know, I'd like to think what I've shared up till now makes perfect sense. So you could argue, well, why don't we do it? All right, so if it makes sense that we have all these factors influencing these diseases that we're seeing, and we can't afford to have these diseases emerge, why don't we just create cities that are more healthy and more sustainable? That's the question I ask myself every day. So we really need to start thinking about integrating health and resilience foresight into how we think about urban infrastructure planning and development. And I'm arguing here that this really requires a complete resuscitation of social imagination. And I say social imagination because some of the challenges that I've encountered in doing the research that I do, say, around health and human settlement, it's just a way, it's just that we've got used to a way of doing things. And the most commonly cited barrier is that's just not how we do things, right? So, but given what we know, can we rethink health beyond healthcare? And this will require engaging across sectors. It will require thinking differently about who's accountable for health. So as a citizen, you know, going about my way, living in a city, do I hold my local authorities' zoning laws accountable for health? Well, I should. It's not just about, clearly access to healthcare is a really critical aspect, and there's insufficient investment in healthcare, that's a given. However, we don't pay sufficient attention and hold accountable the food environment and the built environments around us that are changing in ways that actually make healthy behaviors increasingly more challenging. So rethinking this would need that we integrate this foresight approach. We'd need to rethink the tools that we use as indicators of success, both within the public policy sector, but also in the investment and financing sector. For example, just thinking differently about what financing health means, right? When we talk about health finance, we almost always are talking about the healthcare sector. But could we think about public space as financing health? So that changes completely the range of actors that are involved in creating health, taking that systemic approach to preventing emergencies that we know are a follow-on consequence of these exposures. Oops. Okay, so this is an illustration of what that integrated approach would look like, right? So I put this together, and when I did, I started thinking first about, well, what are the key environments and exposures that we need to support life right? So this is taking a planetary health approach. So I know that the natural environment, the built environment, social aspects of our environment, and obviously healthcare, cross-cutting in all of those is the energy needs and the increasingly urban nature of life across the world. So that's on one end, this life supporting. On the other end, what I've termed life here, for want of a better word, is what we often see as manifest absence of health, right? So which is the disease, or what we see in the healthcare sector, be that acute or chronic diseases, or the patterns of behavior that we know are associated with worse health outcomes. But in between there are these factors that determine, that act as a bridge really between these outcomes that we see down the line and the upstream exposures that we see, often disconnected in both time and space. And that's what sometimes makes it difficult. And the other point I wanted to highlight with this image, and why I didn't draw lines directly leading from one thing to the other, is to draw attention to the complexity of the ways through which these different environments impact on health. So if I talk about food and agriculture, for example, the tendency to think, well, obviously that impacts food security and healthy food access, right? But it also impacts waste pollution, the ways that we manage the food production line. It also impacts air pollution, depending on the manufacturing process. It also potentially impacts on stress and safety, depending on where they're located. So it's really just a challenge for us all to think through, no matter what environment we work on, either as researchers or practitioners, to think through the range of different ways through which these factors, which I've termed resilience factors, can influence disease and health outcomes down the line. And these are some cross-cutting issues. So when I started bringing this together, something started ringing a bell, and I thought, oh, let me map the Sustainable Development Goals to this. So the numbers you see in red are the Sustainable Development Goals. And what was interesting is that it really covered the range of all the Sustainable Development Goals by accident. So the only factors on this that were not explicitly in Sustainable Development Goals are migration and the life stage. Obviously, depending on what life stage you are, the impact of the environment on health outcomes differ, and the approach to address, to intervene in those environments will differ. And underlying all of these really are the importance of poverty, peace, and partnerships, without which we really can't achieve, or would be very difficult to achieve, any of these. So this is just one way of starting to think about integrating health and resilience risk factors for more integrated governance. So it's not just to understand how they impact, but to say, well, who's then accountable for health? How do we finance health differently? How do we understand the health impact of different interventions in cities as we grow? Again, just to flag those dimensions of inequality. So there's 3 points I want to raise here in taking that integrated foresight approach. So just to flag, both because they often, I think, misused sometimes, and sometimes pose a barrier to implementing this approach. So the first really is that is highlighting the importance of not seeing resilience as an endpoint. So I have this love-hate relationship with resilience, because it's often used in the context of, okay, we have this unexpected disaster or emergency we can't do anything about. How do we react to it in a way that is resilient so we don't suffer negative health outcomes? But I think important to resilience, especially when we start taking a foresight approach, is confronting the fact that many of those shocks and stressors arise from intentional choices. right? And so building resilience is not just reacting to the downstream impacts of those, but confronting the decisions that weaken systems and tilt them towards ecological disruption and disease in the first place. The second point that I think would be important to address in taking this foresight approach is the importance of tackling problem blindness. And by that I mean what I highlighted earlier with the example of air pollution, which is the challenge of reacting with a sense of urgency and emergency when the connection between the exposure and the outcome are separated in time and space. So, for example, we have this disconnect between current urban development going on and future hospitalizations due to asthma, right? So we know we know what's happening now impacts on health down the line, but because we don't see it a few days later or a week later, or sometimes we don't even see it in the same physical space, it's very difficult to see that the problem exists in the first place, and that blurs the lines of accountability for long-term health, because by the time the health issues arise, the drivers of the exposures are long gone. And so we have to really continuously think towards the future and looking at the evidence that we know exists to inform what we're doing today. And the third problem or third issue to highlight is this wrong pocket problem, which is this disconnect again between a sector benefiting from an intervention and the sector that bears the cost of implementing an intervention. So we see that, for example, in the context of health through urban development, so where we have siloed public sector budget, what we're seeing is the cost of implementing these interventions might be in the urban development space, but the benefits are accrued in the healthcare space. But this is not something we that we can't dismiss really, because not addressing this does not mean it is not a problem, because we're seeing this wrong pocket problem already exist in that we're seeing the healthcare sector bear the burden of these increasingly unhealthy environments and spaces that are being created in other sectors. So we really have to address that wrong pocket problem, and that really involves thinking differently about health financing. So I'll end with this, which is really an approach bringing the future into the present. I'm a researcher. I work at the University of Cambridge. At pretty much all my work is focused on urban health and urban epidemiology in Africa and the Caribbean, primarily in African cities. And on the other hand, I also consider myself an urban health practitioner because the research I do goes very much hand in hand with my practice, because even coming up with the research questions is not something I would do in isolation in university, but involves engaging with different non-academic and civil society partners to understand the nature of the issues, the lived experience, to understand the kinds of interventions that have worked and why, and to really tap into local wisdom and knowledge to inform interventions. So when I founded Urban Better a few months ago, actually, it really was to address this disconnect between human and planetary health and urban infrastructure and development, disconnect between the present and the future, disconnect between our proactive and a reactive action. And what we're calling for really is radically particular action that focuses on health and sustainability foresight. That's a big mouthful. And I say this because obviously in an African context, we have Agenda 2063, which is the agenda for the Africa we want by 2063. It sets out very admirable goals, including health and well-being, including inclusive, resilient cities. But what we need is a pathway to get there. And so some of the work that we doing in the moment in my practice which will inform some of the stuff, which is informed by my science and will inform the science, is this vision Urban Better. And so I use both these examples from my practice and research to share some approaches that I've applied to bringing the future into the present. And to avoid what we call preventable surprises, because surprises kind of implies we didn't know it was coming, right? But often in the context of urban health, these are largely preventable surprises. So 4 examples of approaches I've taken. The first is the importance of a focus on adolescence. You know, in the African context, our median age is 19. I'm Nigerian myself, and I'm always really astounded by reflecting on the importance of bringing the future into the present. You know, we talk about children being the future. So if we have a whole continent that is primarily made of children and youth, we are by necessity actually living the future today. If only we give greater focus and greater privilege to the voices of adolescents and youth in this space. And we focus on adolescents and some of the work. I've given the links here, so I didn't go into detail on the different examples of the research. But we focus on adolescents in this work with the GDAR network in different cities in Africa and the Caribbean, because obviously adolescence is an age when new behaviors start. We have this increasing independence and approaches to embracing different behaviors, right? So we focus on understanding the lived experience of adolescence in order to understand really how to design interventions in the built environments that speak to those experiences. The second approach is the importance of participatory approaches. So really engaging with communities in understanding the nature of the problem. And the example here is from a study that we're doing, the Alpha study in Lagos and Yaoundé, where we're trying to understand the ways in which people appropriate public space for physical activity. So in public health, we know that, you know, we say that there is insufficient physical activity. Physical activity is an important risk factor for many diseases. We know that, but we neglect the fact that in spite of this insufficiency, we have in cities where it's actually not very conducive to physical activity, people who are embracing and using public space in different ways. So rather than taking a deficit approach, we're taking an asset approach to say, well, let's understand the ways in which different people use different parts of their city. Let's understand the health risks and their motivations and the health risks, and particularly we're focused on injury and safety and air pollution. And let's use that understanding and their experiences to design ways in which to make the city more conducive for physical activity, because we know public space is the most egalitarian way of encouraging physical activity. It's free, right? The third approach that we're taking is intersectoral collaboration, and this is bridging health and human settlements. This is a LIRA study we're conducting it's been coming to an end in Cape Town and Douala, and here we've been looking at perspectives of policymakers and across different sectors in these cities to understand what the governance structures are, what the experiences are of intersectoral collaboration, what the enablers and barriers are, to really start to see the ways in which these sectors can work better together in the public sector. In Cape Town, we're looking at, you know, the health surveillance. You know, when we talk about health surveillance, we talk normally about monitoring disease, but we've got a pilot project to say, can we look at integrating the data on disease, but also surveillance of these determinants of health, so the living environments, characteristics of the living environment, and actually overlay these spatially to understand the ways in which pockets of disease cluster with pockets of poor exposure to or more exposure to unhealthy environments. And lastly, this is just to end off with the context of bringing the future into the present. again with the Alpha study, but also a piece we wrote in the BMJ around changing the language, right? And when we talk about decision making, so can we talk about avoiding toxicity and bringing that toxicity into the present, because we know that that blurred accountability is difficult to get over because of this time and space separation. And again, those dimensions of inequality across those boards are really important to look at, because in as much as health doesn't trickle down from good intentions, addressing inequality also doesn't trickle down from good intentions, right? So you need to deliberately pay attention to the equity dimension, to ask ourselves across each of these, well, what are the ways in which we're considering inequality and addressing those? So last year, obviously, was an atypical year, and it continues to be somewhat. We'd written a piece a couple of years before on the need for bolder thinking and bolder action for health in the African context. And last year, with the context of the pandemic, I wrote a couple of pieces to try and think about, well, really bringing this future into the present, talking about planning now for the next health emergency from an urban environment perspective, and provocatively this piece on a Marshall Plan for planetary health in Africa, to say, can we actually have a rallying point and creed, as it were, to say this is what we're about as urbanizing spaces on the African continent, and ground all our activities, particularly focused on urban infrastructure planning on planetary health. So this is tied into the Vision Urban Better work that is ongoing at the moment. And so this is my last slide, which I'll end on, just to give you an example of the ways in which I'm working to marry my science and my practice. This is the Urban Better initiative. So this is my Foresight practice initiative that's looking at both increasing the supply of health from place and increasing the demand for healthy places, because it's really critical to take a top-down as well as the bottom-up approach. So I see the increasing supply of health from place as a top-down, so looking at the developing space, the building space, the construction space, the financing space, to say, how can we provide the resources that are science-based to inform approaches to center urban development on sustainability and health. So taking this foresight approach on health, to bringing together health and place, and really importantly, increasing the demand for healthy places. We really have to have work cut out on raising the awareness on the importance of environment for health, with human and planetary health, and pushing for advocacy for cities that make the healthy choice the easy, sustainable choice, right? So this is the approach that we're taking here is very much Africa-led, global, and youth privileged. So this work is really just starting, and I invite anyone listening who is interested to visit the website and leave your details, because we really, I think the bottom-up approach of working with youth on strategies to understand, to amplify perspectives. There's so much innovative work going on, and just really amplify and connect those communities and increase the demand for healthy places. Because the reality is the past, we often think about the past as, you know, especially things that we've improved upon, and we look back and think, God, can't believe that we used to live that way. And so this present now, often I feel like this is the future that we'll look back upon. This is the past, rather, that we'll look back upon in the future and think, can you believe that so many people were living with such air quality? Why did we even think that was okay? Why did we think it was okay for under 5 children to be dying from causes related to air quality? It just doesn't make any sense today. So in order to do that, we need to privilege and center the voices and the actions of the youth, because they're the ones that are in the future today, as it were. So that is, I think that's all I wanted to say. And so there's happy to share some of those thoughts on really bringing the future into the present and health proofing our futures through deliberate action. So thank you for listening, and enjoy the rest of the conference. Bye.
Hello, I'm Peter Gluckman. I am chairing this session. I was formerly the Chief Science Advisor to the Prime Ministers of New Zealand for 9 years. I am now President-elect of the International Science Council and close to ending my term as Chair of the International Network of Government Science Advice. We have a session today with 5 distinguished speakers, and I'm not going to introduce them in the interest of time because we only have 1 hour, but our brief is to discuss and give some views on the relationship between science and policy, perhaps drawing a little bit on the lessons from the pandemic and the ongoing issues, but also broadening it out to the more general issues of science advice and the science policy interface. It's really quite complex to look at the issue between science and policy. On one hand, you have the issues of evidence synthesis, that is, what evidence should be brought to bear on a problem, what is the plurality of disciplines that are needed, how much of a plurality of inputs are needed, and of course, there are many ways of doing evidence synthesis. In an emergency or a crisis, it can rely on, does it rely on pre-existing systems or not? To what extent to units such as academies and other institutions matter? And to what extent does it matter on formal processes of science advice? But beyond actually just the evidence synthesis is the component which I think is particularly important and perhaps might be some of the focus of the discussion today, and that is the interface between the actual evidence that's synthesized and the decision-making of the government by senior policymakers and by the politicians, the process which is often called brokerage. And brokerage is the matter of how one takes the evidence and delivers it to the politician and the policymaker, and also how you take the needs of the policymaker and the politician and take it to the science community. In many ways, I see it very much as a translational, interpreter, diplomatic role as opposed to a technical role, and I think the soft skills of maintaining trust are very critical to that process. But it's difficult. And the issue is, does it depend on pre-existing mechanisms such as the UK, Canadian, New Zealand systems of a pre-existing science advisory mechanism where you have people experienced and selected for their skills to be brokers and also interface with the evidence synthesis system, that is the scientific community, or can it be done ad hoc as needed? I think it's too early to tell from this specific event of COVID, but I think it's a question which will be asked increasingly over the next 2 years as countries look back on how they handled the pandemic, and do pre-existing mechanisms and institutions need to exist, and then what are the skills of people that inhabit those? Now, just as a way of a final advertisement before I open up and turn over to the next speaker, The International Network for Government Science Advice, on its website www.ingsa.org, has been collecting information from over 120 countries through the pandemic on tracking how, not on the outcome of the decisions, but actually on how evidence was incorporated into the decision-making process. And those of you who are interested in looking at the different ways this has been handled might want to look at that website. So with those introductory remarks, and I'd like to hand over now to Sir Patrick Vallance, who's the United Kingdom's Chief Science Advisor and who co-chaired with me the first meeting of the Commonwealth Science Advice Network, to give some thoughts. Patrick?
Thanks, Peter. Well, hello, everybody, and thanks for having the opportunity to just say a few words about three things that we were asked to speak to: lessons learned from the current pandemic, some thoughts about what leaders might think about in terms of actions in this and other areas, and what the next generation of scientists coming into this might take as ways of getting into science advice. So let me start with lessons learned. The first thing is that before all the pandemic, I was talking about science advice and saying there's nothing like an emergency to make politicians sit up and take notice of science and bring science into the heart of government, and that's an opportunity to be built on. Well, we've had a massive, long-lasting emergency, and there's no doubt that science has been absolutely central in every country. And as Peter has said, there's a really important distinction between the science advice, the policy decisions that come from that, or the policy options, and the decisions that need to be made by politicians. And I think that balance between what's advice and the evidence base, how does that interact with all of the other considerations that are needed for policy formulation, and how ultimately politicians make decisions, have been starkly exposed during this pandemic. Second area to think about, and this has been one that's been a real lesson for us, and I suspect for others, is we have a very well-established mechanism both for government science advice and for emergency science advice, but we've never expected an emergency to last a year. And so the question of resilience in the system, resilience in the people, and the ability to really keep giving high quality science advice across a range of topics means I think we need to look at our systems going forward to see, are they fit for long-term problems like a pandemic versus shorter term problems which you normally have to deal with. The third area in terms of lessons is around transparency. And in the past, with short emergencies, the way it's worked in the UK is the information, the papers and so on received were published after the event. That's clearly not possible in an emergency, a long-lasting emergency. And we made a decision, it was not easy to get it through all the system, but we made a decision that we wanted to publish all of our papers we saw and all of our evidence. And that's had a big advantage to make everything in the public domain. This has been a pandemic that, of course, has involved everybody, and the public want to know how decisions are made. So transparency, I think, has been an important part of this, and actually has been very helpful for science advice. It's been helpful for us to be able to point at the papers and say, this is what we were saying at the time. And of course, there are other parts that go into decision making. And I think there's a real lesson here, both positive, as I've just described, and a potential negative, which is that the total transparency of the system does make some policy professionals reluctant to ask for the science advice if they think it's all going to become public. So there's a tension there that's worth thinking about. I'd pick up a few other areas. There's never been a more important time in which to be able to describe one of the key challenges in science advice, which is the articulation of uncertainty. How do you explain uncertainty to a politician who needs to make a decision? And framing that has been crucially important during this. Data availability, we know that data availability has been central to being able to track, monitor, understand, respond to the epidemic. And certainly, I think many countries, and ours was no exception, found that data availability, interoperability, access were things that were not as easy as they should have been. And therefore, that has relevance to how one thinks about emergencies going forward. And my final general observation would be around science advice and science operations. And I think getting those two things linked up together is important. You may wish for all sorts of things in science advice, but there are operational parts of the system that need to work in concert with that if you were to get the response. So those are some lessons from this pandemic. And I'd pick up in relation to them things that leaders might think about in the heads of government meeting. The first of those has got to be around surveillance. It's crucial that we have global surveillance systems for both picking up, in this case, the virus and its variants, the mutations, but of course, going forward, other diseases as well. So better surveillance system, improved data sharing, and another area that needs to be looked at. And of course, the equity of ability to give response measures, such as vaccines, equitably across the Commonwealth, I think is a key area. And then my final general point is around next generation of scientists coming through. And a very positive outcome during this pandemic from our perspective has been the number of scientists who wanted to work in government, linked with government, come on secondments, attachments, give advice. I think we've got a whole generation of people who'd never thought about their work being relevant to science, or never thought about them as individuals being able to step out of their specialist science role into an advisory role in government. And we've had the most terrific younger people coming in, wanting to learn about how to do this. They've been a great asset to us, and they broadened, I think, their approach to science as a result of what they've done. Peter, I've overrun by 30 seconds, so I will stop.
Thank you very much, Patrick, and they're really some very valuable points. I'd like to now ask Dr. Sabin Nsanzimana, who's Director General of the Rwanda Biomedical Centre, to make some comments from Rwanda's point of view. Of course, this meeting was originally meant to happen in person in Rwanda, and I've been talking to President Kagame somewhat in the last few weeks, but we welcome some comments from Rwanda.
Thank you so much. You're still welcome to Rwanda anytime. I think COVID shown us that we can do things differently, but still we can overcome challenges such as this pandemic, something you never seen before, almost 100 years ago. Something similar happened, but I also spent a few minutes just reflecting on a few things about COVID-19, the lesson we've learned, the challenges, and how we can take it as a lesson for a way forward, thinking about how science, policy, but also community that is important, because all we do is to improve the lives of people we work with. So I have 4 points, actually, I want to go through, almost similar to what my colleague has just talked about. Number one is between policy and what comes first. I think it's the egg and the chicken, because for me, science informs the policy decisions, but also policy, it can also influence the scientific work that can be created because there is a need moving forward. So looking into the role where the community plugs in this whole process, you also think where the community will be. Is it in between? Is it on one side of this connection? But I think the community guides all we do, because it starts from research question, from scientific curiosity, the interest. But at the end of the day, whatever the policy decisions are made is to make the lives of people better. The other thing I reflected all about is the health of people and how it guides all we do globally. When one virus came and stopped all our movements, has been a challenge for sure, but also has been another eye-opener to all of us that preventing these pandemics it's actually opening up our business, our movements. So whatever happens in the future and blocks us to move forward will affect all of us. And then for scientific community in the health sector, that is an interesting start to see how important this domain, this sector has been not completely forgotten, but the place and the interest that the policymakers are giving to the health is different from how we're seeing it before COVID-19. The other thing is time and speed. Looking at how long to take to prepare a system, to do testing, to develop test kits, to develop a vaccine, and now with COVID-19, reducing time from 10 years to 1 year, or from three years to just 3 weeks, is an interesting move that we get as an opportunity from COVID time. Unfortunately, COVID has affected us, but we are learning a lot from it. So I hope this speed remains, and we guide not only scientific work, but also the policy making and implementation to change the lives of the community. At the end, this is the whole purpose of all we do. So a few examples from Rwanda, as you asked. Since we've been battering this pandemic almost 12 months ago, and now we've learned a lot from the scientific work. In our case, we adapt our measures in COVID response, similar to other epidemics. But now we see the role of science much more than before. We have a scientific advisory group that runs all the numbers, the data we collect all the time, the different digital platforms that were deployed in just a short time. And now we're getting data and information in real time, and our decision makers can easily pick it from there to decide whether tomorrow will be this testing, or if there's a lockdown to be made, what the basis, and if we have to lift it, what do we have to do based on evidence, on scientific information that is evolving so rapidly, and the measures in COVID-19 have been also very evolving and very fast. So my last point is on the global solidarity in this context of COVID-19. The science has no limit, for sure. But looking at how some policies and decisions have been made in the past, and currently with vaccine availability, you will see that although the science has some openness, scientific works, we are collaborating with different researchers across the world. But when it comes to what the science tells us to do, what have we got from this partnership to make policy and actions to the communities, like availing vaccines to people? That's where the challenge is coming, and that's where we need to work on and bring this global solidarity against diseases and epidemics, pandemics. I think we wish this could be the last, but evidence that COVID-19 will be the last pandemic. But how do we prepare for that? It's having more scientists working together, young generation, young people joining experienced scientists to inform and influence better policy decisions, and remove this unnecessary to access these scientific advances. Thank you.
Thank you very much, Sabin. I'd now like to ask Dr. Vernon Lee from the Communicable Diseases branch of the Singapore Ministry of Health and head of its COVID-19 tracing system to make some comments. Vernon?
Thank you so much, Sir Peter. So I wish to echo the points that had been brought up by my esteemed colleagues earlier. And I wish to focus on 3 key points that already has been discussed, but I would like to just expand more of. So I think evidence-based policy making is one of the things that's been brought to the fore during this COVID-19 pandemic, precisely due to the uncertainty involved in this pandemic over the past year, and due to also many unprecedented characteristics of this pandemic, both the pandemic itself, the duration, the severity being, not that severe compared to some of the other epidemics like, say, Ebola or SARS, but at the same time not as mild as, say, the 2009 pandemic influenza. And because of this, it has led to response to the pandemic, which includes lockdowns, closure of borders and travel, different public health measures, and also the rollout of novel vaccines to large populations, all of which has created a lot of different issues that requires very strong evidence-based policymaking to address. Now, this fast-paced and fast-changing pandemic has also shown that the changing scientific evidence and how policy has to adapt to this needs to be considered. And this has to be not just considered in the scientific context, but also with other social, political, and economic issues. Now, this pandemic is obviously quite clearly led from the fore by evidence-based policy, as I've mentioned, from public health measures such as the wearing of masks, and this is one of the issues that I think we in Singapore and many other countries have been grappling with, and it's very much related to the evidence of pre-symptomatic and asymptomatic transmission. So initially, if you recall, some of the recommendations were for symptomatic individuals to wear masks, but this then quickly moved towards recommendations for the general population to wear masks even if they were well, because of the evidence emerging for pre-symptomatic transmission and also asymptomatic transmission that had occurred. Now, that was the evidence, but this had to be interfaced with the supplies of masks, because none of the masks, whether it's medical grade mask or other types of disposable or reusable masks, were stockpiled for the entire population for a long-drawn pandemic. Most countries had stockpiles of masks for their healthcare workers to use for a pandemic of an estimated 2 or 3 months duration, but certainly not one that would stretch more than a year. So the science, wanting the population to wear masks, would have to then be interfaced with the supply of masks and how to roll out these recommendations at the right time so that you don't have the run on the market. So I think some of these things require a lot of balancing to enact. Now, the other thing about the fast-paced pandemic also meant that policies had to be developed with the available evidence. And the issue with scientific studies is that they often take time to gather data, to analyze them, to be reviewed, and to be published, often requiring months. Due to the uncertainties, it was also very important to be able to develop various mathematical models to be able to stay one step ahead of the existing scientific knowledge. But all this creates a myriad of information that makes it extremely complex to interpret what is valid and what needs further study. So faster and more open evaluation and sharing of information is required, and the current mechanisms, although fast, can still be improved upon. And this is, I think, where we can work together as a scientific community to do something during this pandemic and in the future. Of course, science, while a key consideration, is not the only consideration in policy making. There are many other decisions that will be based on the science, but policies often take into account other considerations such as economics, public interest, and also communications, both internal and external communications. Therefore, having pre-existing mechanisms are important. For example, in Singapore, we have an existing national crisis management system that meets on a regular basis annually, together with participating in regular exercises, both on infectious diseases, pandemics, and other crisis situations. And having been through multiple epidemics such as SARS, pandemic influenza, and so on, allows the familiarity with between policymakers and the scientists, and incorporation of science into regular policy making. Which brings me to my last point, which is, together with having all these systems, we actually need good individuals who can influence policymakers and politicians, and also the public. These people will need to be persuasive and able to explain complex issues in a simple to understand method, be confident of their scientific knowledge and basis of which this scientific knowledge is acquired, and also to have a close listening ear of key policymakers and politicians. Therefore, as part of our collective training, we will need scientists to be exposed or trained in some form of policy making to understand the complexities of policy making, that is, sometimes incorporating science and all other considerations. And we also need to have policymakers who have a strong scientific background to understand why certain scientific advice needs to be taken in and how it should be used in evidence-based policy making. So I hope that this will form the foundation of the subsequent discussion, and also will form the foundation of our response to the rest of this pandemic and also to future pandemics in the to come. Thank you.
Thank you very much, Vernon. I'll now turn to Dr. Mona Nemer, who is the Chief Science Advisor to the Prime Minister of Canada. And Mona, good to see you, and I'd like to hear your comments.
Thank you very much, Peter. Good to see you and good to be here with all my very esteemed colleagues. I'd like perhaps to emphasize some of the points already raised by my colleagues. And perhaps I'll stress three things. One is on the science advice system resilience. I think this is very important. That was put on the table by Patrick. The importance of relationships and the diversity actually of relationships that need to be built and maintained for efficient, I guess, science advice giving and receiving. And the third one is on transparency and public dialogue, but also what this means for science literacy around the world. So, I mean, it's remarkable that here we are, 1 year after, or a bit more after the sequence of a new virus was revealed. We have vaccines. In less than a year, actually, some countries started vaccinating. We had diagnostics right away. So science has given us incredible tools and very rapidly to manage this pandemic. The remarkable thing that probably we haven't witnessed before is also the real-time transfer of this knowledge and the discoveries to evidence and to providing them to our politicians for decision making. So this has definitely required setting up a lot of brokerage systems, a lot of advice, and I can assure you that governments have received more advice probably than they had asked for. So in many ways, the whole issue of brokering the advice was quite challenging. And not because colleagues didn't want to participate in providing the advice. In fact, a year ago, I set up a multidisciplinary expert panel. We've met over 40 times. We've added people to the expert panel. We've created task forces. And I have had to be on many of them. So I think the resilience of the individuals and the system is already very, very obvious. But we were not the only ones providing advice to government. Many other colleagues were providing advice, sometimes publicly, sometimes privately. As we know, there were a lot of uncertainties. We were basically writing the playbook as we went, and as normal in science, people were having different interpretations and recommendations based on the same evidence. And I think that the public was simply not ready for that. So many people wanted to have more science, to understand decisions, but in other cases they were confused, and in some cases actually this uncertainty and this diversity of science advice that the public was hearing was a place that is ripe for disinformation, for conspiracy theories, for everything. So I think that, of course, that raised the whole question about whether the public was prepared to understand how science functions, how evidence is built, how there are no absolute truth, and so on. And in fact, whether the politicians themselves were not always prepared to embrace all the advice. I mean, if the issue was borders, they wanted to hear about borders. If the issue was rapid testing or vaccination, you just had to focus on that. But as science advisors, we had a longer term vision, and we knew that many of these issues needed to be tackled together or else you'd have to go back and restart all over again, explaining and at times changing. Why are we changing the advice, whether it's masks or others? I guess one of the example I will give in terms of the plurality of advice and science voices, we lived it recently and in other countries as well, about the vaccination, about whether one shot is better to give to more people, whether it's better to respect the data that came out of the clinical trials. So you had as many clinicians and scientists advocating for delaying the second dose as there were for respecting the data and the evidence and the clinical trials. So you can imagine how that got a lot of people confused, and just like the cacophony of voices became quite incredible. Some credible voices, others that were less credible, and the public is certainly not equipped to judge whose voice is more credible than others in cases like this. So I think that, of course, raised also the issue of transparency. You might as well, from the get-go, explain what we know, what we're certain about, what we're uncertain about, what can change, what may not change, and so on. And also not just communicate it and explain it, but communicate it through different channels, through different ways, because one size fits all, we all know, just doesn't work. We have diversity of population, we have diversity of understanding, and also of priorities, for example, of health versus economics. So there were people that cared a lot about their health, others that cared more about the economics of the crisis. And all these perspectives needed to be brought together and understood at the same time. So I'll speak maybe to the system resilience. I think is something that's extremely important because, like I said, I had my expert panel. We've met once, sometimes twice, every week over 1 year. These are active clinicians and scientists, so they're doing it on the side, and they were called upon to be as part of other task forces. And as a matter of fact, they were called upon to be part of advisory groups for local governments, whether provincials or municipal governments. So they were more than double and triply booked and providing advice left and right. So I think that we need to think about the resilience of the system and how we can prepare more scientists to be able to provide science advice. The last point is on relationships. And relationships were extremely important domestically and internationally. And I want to publicly acknowledge all the help that I have received from you, Peter, before the pandemic, from Patrick and his predecessor before and during the pandemic, and the many other colleagues with whom we met and exchanged over the course of the pandemic. But also domestically, relationships were very important, of course, when you're providing advice to the Prime Minister, to ministers under extremely tense, difficult situations. I think that then, if you didn't have a good working relationship and a sort of mutual trust, it would be extremely, extremely difficult. But beyond the politicians, it's also relationships with the senior bureaucrats or public servants whose role also is to provide advice to government and to implement advice and policy options that you and others are providing. And then lastly, relationships with colleagues who are head of granting agencies, who are overseeing or making recommendations on research gaps, on what needs to be done, and doing it really in a way that is what we call whole of government. So that is not only with the Ministry of Health or only the Ministry of Economics, Industry, etc., but a more wholesome perspective. I think that is extremely important. So, and then of course there is the space that the science advisor in a pandemic is occupying versus the chief public health officer, whose role and mandate is to provide the medical and public health advice. So I think all these things had to come together very quickly, seamlessly. You certainly didn't want sounding like you disagreed with your colleagues from the public health agency or from the medical establishment or the scientific establishment for that matter, but you had at the same time to protect the independence of the office, and that was quite an incredible journey. So I certainly look forward to lessons learned in Canada and elsewhere, and to continue working together with the entire science community and science advice groups to continuously perfect or up our game in preparation for the next crisis that we don't know from where it's going to hit us. Thank you very much.
Thanks very much, Mona. I think some rather common threads have come through all the comments, and I think I'd like to just pick up on one or two while I'm waiting. I don't know about the others, but my screen is somewhat unusual at the moment. The first is about relationships, which Mona in particular focused on. And I think the issue of whether a system that does not have pre-existing institutional arrangements in place, like a science advisor, has more difficulty in getting those trusted relationships rapidly. And so I think the set of skills one needs to maintain relationships, even though you're a scientist, are actually the skills of diplomacy and so forth. Not every scientist can be a science advisor. And I think that one of the things that when we look at this in retrospect will be to see whether this does encourage more governments to think about establishing various forms of science advisory mechanism. I've been working in the recent months with a number of governments who are now looking at the more general issues of science advice. A second, which was raised by, I think, all the speakers, was about the issues of trustworthiness. That the science advisor's key role in many ways, or the people at the interface, must have the trust of the politician, the trust of the officials, the trust of the public. And at times, as Mona alluded to and others, that's been rather difficult in terms of the rise in some countries in particular of anti-scientific issues, and I think we're going to see more of that with issues around vaccine, anti-vaccine misinformation and so forth. And therefore, I think a lot of the role that Patrick alluded to around transparency, around, in particular, of advice, and ways you ensure the trustworthiness of the advisory mechanism is critical. And then Mona raised the issue of the cacophony of voices. And how do you manage the scientists who are not part of the system, but are using the media as ways of trying to impact on the decision-making process? So it's a complicated system. I have the disadvantage, I don't have a full screen of other here, but do any of the panelists want to make a comment before? Patrick, do you want to add more?
Well, I think those are absolutely key areas. And I think on your first point that Mona raised about relationships, as she said, there are many different relationships which have had to be forged during this. But I would believe that it's much more difficult to give science advice if you've never had a relationship, and therefore there is I think there's quite a strong argument for having science advisors embedded in government for the simple reason that you have a starting position where you know people, you know where people fit into the system, and you have access to people in order to be able to give that advice and for it to be heard and trusted. So I'd be interested, if anyone wants to counter and give a different view, but my starting point would be that is quite a strong argument for having a standing science advice system in government because in the times of an emergency, it can swing into action very quickly.
Mona also raised the point, which I think is interesting in her last point, about the potential for the need for a good relationship between the science advisory mechanism and in this case, the mechanisms that were delivering the actual health system, the Ministry of Health, the Director Generals of Health, and so forth. And certainly in some countries, the front face has been the Director General of Health, as in New Zealand, whereas in other countries it's been and I guess you could argue in the United States with Dr. Fauci, whereas in other countries it's been the science advisor has taken the public-facing role. In my view, I don't think it matters particularly much as long as they have a good relationship and as long as both can be seen as trustworthy and transparent in what they're saying and have the skills, as Patrick alluded to, and as I think Vernon alluded to, of being able to explain uncertainties, probabilities, and the point that the science had many unknowns in it. Again, I don't know, Vernon, if you want to comment.
Thank you so much. Yes, so indeed, I think the two key things is that once you set up a scientific, sort of advisory panel, you can't just have that set up, on the fly during a pandemic. It has to be something that you do a priori, and you have to have that continual discussion between the scientific committee, the policymakers, for sort of very routine and even sometimes mundane, policies for a whole variety of infectious diseases and other crises. I think that will then engender that, the confidence and also an understanding of the, the science, the policies, and also the interactions between, the committees and the policymakers. The other thing which I alluded to also is to have, especially, junior or even senior folks to be seconded to the respective organizations. So, for example, for policymakers to spend some time in scientific organizations so that they understand how scientific organizations work, how science is developed, and why sometimes it takes time for some of the scientific data to be collected and validated. And likewise for scientists to spend time in policymaking agencies so that they are able to understand the complexities of policymaking that's not always so cut and dried or black and white, that there are a lot of gray areas because there are a lot of other considerations to be taken into account, and how does evidence-based policies get made on a routine basis. So I think it's very important to have that common understanding during peacetime, so that during a crisis, these mechanisms and these linkages can just be brought to the fore very quickly, and it doesn't have to be reinvented on the fly during a crisis mode. Thank you.
Thank you, Vernon. I understand that Professor Vijay Raghavan has now been able to join us, who's the Principal Science Advisor to the Indian government. Vijay, if you're there, would you like to make a few comments on how you see the science advice mechanisms evolving in the face of COVID and after it?
Thank you very much, Peter, and my apologies for coming in late. Some of the hazards of my day job doing just what you pointed out in your question. So sorry about that. Sorry for coming in late. One of the problems which we're facing all over the world is the extraordinary volume of information and the breakneck speed at which it comes, and the requirements to sift fact from fiction and to make predictive analysis of what is coming in. And this has put an enormous pressure on scientists at every level and on science advisors. And, it's in one level exhilarating because science is at the core, and this is an opportunity to communicate science. But, it's also pointed out to the great importance at being having ways by which one can be there around the clock and looking at new scientific information and communicating it. Now, the good thing about the situation in India is that a variety of people communicating on national television, media, and so on, has greatly enhanced the importance of science. The challenge, of course, still remains that one is not in short supply about news which is shooting from the hip, as it were, about interpretations and having to deal with that.
Thanks, Vijay. If Dr. Sabin Nsanzimana, from your perspective, Rwanda does not yet have a formal science advisory mechanism of the nature that the United Kingdom or Canada has, but you clearly have very close relationships between the science community and the official community, given that, close relationships. Do you think that when you extrapolate from the pandemic to non-pandemic, non-crisis situations, that there's a need to have a standing mechanism in countries analogous to the points that Patrick made about the fact that the pre-existing relationships need to be there to be effective in science advice?
Thank you. I think we have a scientific advisory group that has been very helpful in COVID time. Almost 12 months now on job, meeting every Friday and putting together the science that is required for the policymakers, including the government decisions. And these are not people just sitting here in Rwanda. They are different scientists from different continents who are part of this group, who have been who are driving these actions and changes and helping to contain the pandemic. So the fact that building this team of scientists in one day or in 1 year, it's not something really to happen. These are people who have been there actually supporting different capacities, but now COVID has been an opportunity to bring them together and advise not only Rwanda, but also the rest of the other countries that are part of different platforms that we use to communicate the science. So I think from the previous speakers, there's an interesting element to highlight on the amount of science and data that is being published every day. Sometimes we used to have a paper being reviewed for 6 months, even a year, before it's published. Now it's almost a week or less. So we should be very careful about this. And I like the way it has been addressed by my colleague from India, because this is the thing we've been fighting from the beginning of this pandemic, the infodemic that is backed by a science that is not verified sometimes, and working with scientists across the globe. The case of Rwanda, we've been working with scientists from different organizations and countries, and this has helped us really to be updated and take proper actions for COVID, but for other diseases as well. I remember the time where to have just scientific meeting, it was really hard. People always have something to do on their own, academia, scientists, teachers, researchers in their own lab. But with COVID, you will see people coming themselves asking to be part of this because it's important to the community. That's why I was saying in my previous intervention that it is a challenge for the world, but also it's an opportunity for the scientists to work together and make the changes that generally is brought by the science to the humanity.
One of the things that Mona wrote, there's now the questions are coming forward, so I'll put a question to the panel here. Honor Bixby has asked, how do you balance changing science and updating policy while maintaining public engagement and trust? Well, I think we've been discussing that a lot, and I think the issues of actually the fact that COVID was not the only thing going on in this time. I mean, there are many other issues that governments are dealing with while dealing with COVID. has been a challenge. I don't know, Patrick, whether you want to add to that as a person who's got responsibilities across the whole of government in ensuring science advice. Did you find that you had enough infrastructure to cope with issues beyond COVID at the same time?
Well, we have. I mean, they've definitely taken second place, and they've suffered as a result of the huge focus on COVID. But I mean, and I'm sure it'll be the same for others on this call. We've also been dealing with climate change, net zero, carried on looking at that, and biodiversity and various other areas that we have issues with that have carried on in the background. But they've definitely taken quite a big hit in terms of the amount of time and bandwidth anyone has had to deal with it. I would like to just answer the question that Honor Bixby's asked as well, though, if I may. I think it's a really important question, and Mona alluded to it as well in terms of changing advice, for example, on mask wearing as evidence changes. And I think it has been confusing for the public to see science, which is often portrayed as a definitive thing, which gives clear answers, which of course it's not. It's something that's always progressing and changing, as we know. But in the public's mind, it's often been seen as this is the answer because it's science, and then it changes. And so I think it's been a very important educational process to sort of explain uncertainty in science, and to be able to sort of say, this is what we do know, this is what we do not know, and this is what we may find out by things that are going on at the moment, and when we might find it out. And being able to sort of articulate things in that way, I think, has been important in terms of getting expectations right and being clear that a change in advice based on change in evidence is what science does. It's not that science gives you a single answer that you just stick to, come what may.
There's a set of questions here about training, and I think many of them have been partially addressed already. How do you advise that early career researchers begin engaging with policymakers? Understandably, senior experts are often called on, but it seems that building the necessary skill base early is important to leading to effective engagement. Well, I think Vernon, excuse me, and others have really addressed that question, saying part of it is about scientists learning early how policy is made. I think often I find that young scientists are surprised that policy is not a simple process. Policy making is a complex process, it's not linear, and that I think unless one embeds oneself either by internship or by taking in courses such as those that INGSA operates or others operate, or even locally within your universities, the assumptions you have about policy making being a simple linear process have to be overcome. And I think, ultimately policy making is about making choices, and those choices affect different stakeholders in different ways. What evidence can do is help guide the policymakers to what are the consequences of each option. But ultimately, as Vernon and others have pointed out, many other factors have to be taken into account in decision making. That's what policy making and politicians, that's their job, is to make those choices between options. Our role is to try and give the evidence that can best assist those options. And I think the only way to do that is to make sure that you do have an understanding of how the policy process works. And that, I think I've found over the many years that scientists often have a very naive view of the actual process, which is different in different countries, obviously, but the same principles apply, that there are many factors coming to play. VJ, Mona, you want to comment?
Peter, I wanted to give a couple of examples that we have done in Canada to bring on board the young scientists, clinicians, or researchers. One has been through, I have a youth advisory group, and what we've done is invite one or two of them to some of our expert panel discussions and deliberations on topics related to their own research. So it's been an eye-opener for them to hear the experts and see the different things that need to weigh in. And the other example, actually, we've set up, we have a testing advisory group, and we set up a shadow, panel made up of young researchers and medical students. And what they've been doing is putting together the evidence, options, and so on, presenting it, and of course, hearing and being part of the discussion and the back and forth. So I thought that was actually quite, interesting for, of course, a small group of them, but still to see how it's done in real time. And of course, there are other activities like Science Meets Parliament, where we brought in early career researchers, principal investigators and professors to meet with policymakers and understand their world. So just wanted to put this on the table.
There's a set of questions, thanks Mona, there's a set of questions here about the plurality of science advice. I mean, the question was put here, sometimes on the African continent, one person will make all the decisions in all branches of science, and I'm afraid that he or she does not have all the answers. Well, again, I think that each of the speakers here has talked about integrating the role of the mechanism to integrate different fields of science. But one of the comments that I would make is the importance of good social science alongside natural science sitting within the science advisory mechanisms. I don't know if any of these other speakers would like to comment.
May I, Peter?
Yes, yes, please, BJ.
I don't think the grappling with the complexities of decision making are necessarily eased or made more difficult in different geographical contexts. I think all of us have a huge number of parameters which one has to deal with. And of course, there are more people being involved in the advisory mechanism, it helps. But that said, the success in decision making is a combination of informed science and circumstance and the situation, fortuitous nature of various things. So it's very difficult to predict how advice will go. It's not just the validity of the advice at a given time which dictates whether it goes into policy or not. As Peter has said, as Patrick has said, the validity itself changes, and that's complex enough, but the situation is also quite nebulous that it's not easy. So it's tough everywhere. And the pandemic has shown that there's a difference between making policy, being prepared, and being responsive. And all these things are very different.
Thank you. We're running to the end of the session, so I'd like to ask each of you just in 30 seconds to make a final comment. And in doing so, given that this is a Commonwealth meeting, one of the questions there is there a role for greater collaboration within the Commonwealth on science advice? And some of you, and Patrick and I, have addressed that question in the past, but would be interested in ongoing comments. And so I might start with our host, our nominal host in Rwanda, Dr. Sabin Nsanzimana. Do you have any final comments in 30 seconds?
Absolutely. One is to appreciate how the science has evolved in the recent days and how scientists are collaborating much more. I wish this could continue and young researchers could join this move. And the second is what comes from the science, from discovery, from all the innovations is translated into policy making. That is where we have a gap to fill. On the side of policymakers, but also on the side of scientists. And last is, welcome to Rwanda, and we have more science to discuss. Thank you.
Thank you. And Mona, some final comments?
Yes, thank you very much. I think there is a huge place, for science and science advice collaboration within the Commonwealth. We didn't talk much about the issue of sequencing the new virus strains and understanding their distribution and the effect of vaccines on them and so on. I think this is an area that is, of immediate and probably long-term interest. And I think that a lot of the question about as well, modeling disease spread, about vaccine, collaboration, about etc. I think all these are areas where we can do a lot more working with each others. Thank you.
Thank you. And Vernon?
Yes, indeed. I think there's a lot of room for greater collaboration between scientists and also policymakers across the Commonwealth. And I just wanted to say that because of the fast-paced nature of the pandemic, I think it's very important for scientists, policymakers to really come together, share the evidence, share the considerations that goes into policymaking. But once a decision is made, we just have to stick to it and move on, because there are a lot more decisions that will have to be made coming forward. So I think that's the advice that I can give. Thank you.
Thank you very much. And Vijay, do you want to make a final comment in 30 seconds?
Briefly, all of us are very well connected with each other. Each other. You have connection, very important.
Patrick, do you want to make final comments as co-chair of the Commonwealth Science Advice Network?
Yeah, I mean, there must be more opportunity to work together. Several of us on this call have been working together throughout the pandemic, and there's been a remarkable cooperation and collaboration between scientists during this pandemic. The challenge is to keep that going afterwards in normal times, and I think that's something really worth striving for.
Well, look, thank you, everyone. I'm sorry we don't have another hour, because I think the questions here were really very important and we couldn't get through them all. I would just like to make one last point, and that is the Commonwealth is unique in that it has a large number of small countries, small island developing states in particular, who have got very limited capacities. And I do think that one of the issues for another discussion is actually how those countries which have developed systems can help without being patronizing those smaller countries who just are very limited in what they can do. I've been spending a lot of my time with a number of the small island states of the Commonwealth dealing with. Well, look, thank you to all the panel. Thank you to all those who have been listening in, and I hope you found this a valuable session. And I look forward to further discussion through the Royal Society around the relationship between evidence and policy. Thank you very much.
It's a tremendous honor to be a part of this Commonwealth Science Conference and to accept the invitation to join with colleagues in developing conversations around these most very important topics. I recognize all of my colleagues in academia, and I am truly grateful to be a participant in this conference. The broad theme of the conference, Science for a Resilient Future, is indeed very relevant to all of the issues being faced by development agencies, by academia, government policy projects, as well as grassroots organizations. These themes are of a global nature and most relevant to communities across the world, especially the two concepts, the concepts of resilience and sustainability. Oftentimes, I think they are used interchangeably, but effectively, they speak to different historical processes and have generated tremendous conversations in development discourse. Resilience, of course, might very well speak to issues such as the sustainability of traditional paradigms and methodology, the extent to which the reality as we know it today can survive through the turbulence of the present. Sustainability, on the other hand, calls into being a very different set of conversations about change, about the inevitability of change, about the demand for change and the search for stability around concepts of development. So yes, so while sustainability might speak to a future form of resilience, resilience in itself might be a conservative, if not reactionary concept, whereby sustainability is indeed dynamic, radical, progressive, and transformational. And of course, in the context of COVID, these two concepts are called upon to focus our imagination, because COVID has changed everything. It has varied from place to place. I speak as a Vice Chancellor of the University of the West Indies in the Caribbean, and when we examine the impact of COVID in the Caribbean world, what comes into being are concepts of history, of colonialism, of racial inequity, of injustice, of gender, of community, and the impact of economics upon diverse communities. So COVID has really torn the roof off the house of the Caribbean, and indeed in many other places in the world. And by so removing that roof, enables us to look inside. And we are not happy with what we see. Those of us who are committed to a democratic paradigm, to issues of justice and equality, when we look within the structures that have had their roofs torn off by COVID, we actually see things that are calling for a very different approach to development and to the validation of society. In the Caribbean, we speak of the triple C impact. We have been coping with the concept of climate change and the impact of rising sea levels, warming seas upon the Caribbean economy. The devastation is obvious. Islands are shrinking because of rising sea levels. And while we have been coping with the impact of how to evaluate climate change from a scientific perspective, the history keeps pushing into the paradigm, into the concept. Then we've been coping with issues of chronic diseases, the pandemic of chronic diseases, hypertension, diabetes, that have ravished the Caribbean and is posing an existential threat to our communities. And in come COVID to deal and to engage with chronic diseases and rising sea levels, climate change. And of course, we know the literature have shown how all of these relationships are interactive and posing serious threats to the resilience of institutions, of nations, as well as the call for a new sustainable approach. When I served as a member of the United Nations Secretary General Ban Ki-moon and as a member of his Science and Sustainability Committee, what we experienced in many of those meetings was the absolute need to create an interdisciplinary dynamic discourse precisely around these conversations of resilience and sustainability. But I would say, if I'm not going beyond the boundary, I would actually say that the many conversations we had on that committee focus around the broader theme of decolonizing the sciences. And there we engage in the historical sciences, the social sciences, what has historically been called the natural sciences. And we saw the need to enter a process of criticism around the very themes of resilience. we discovered that many of the traditions of science were rooted in imperialism and colonization, that many parts of the world had indeed been subject to imperial impositions as to what is the relevance and the importances of sciences. And indeed, post-colonial intellectual communities have indeed validated many of these traditions that were rooted in empire, especially in the West. And since we were looking at global societies, societies that had largely been colonized, where citizens have had their resources extracted, societies where slavery and slave trading were important, and where indigenous people had been subject to land displacement and being corralled on reservations. When we look at all of those issues, empire, colonization, came to the fore in all conversations around resilience and sustainability. And in the case of the issue of philosophy and science and race, you know, we go back to John Locke, arguably the finest of Europe's philosophers in the 17th century, and the issue of how philosophy and science became the basis of empire. And he articulated very, very clearly a science of race. And he himself was a slave trader. He was a colonizer. He was the corporate secretary of the Royal African Company, which had a mandate to take 6,000 enslaved Africans to the Americas on an annual basis. When he was asked to articulate the relationship between freedom and liberty, which were his concepts, his intellectual contribution to humanity, with his relationship as a slave owner, he merely made it clear that there was no contradiction, that the African people were not a part of the human race who were subject to his discourse on liberty and freedom. That the African people were a subspecies that did not fall within the paradigm that he had articulated about freedom, justice, and human development. And from the beginning, therefore, we saw this relationship in the scientific discourse between economic development, race, geography, and culture. And not surprisingly, 100 years later, when Adam Smith, the economist, who is identified as the lead theoretician of the rise of industrial culture in Western Europe, industrial civilization in Britain and beyond, and showing how sustainable development and resilience could be more effectively delivered in a context of free trade, in the context of market economies, in the context in which democratic systems of governance should function. We realized that what Smith was actually saying is that slavery had become obsolete, that it was better from the point of view of wealth accumulation to free the millions of slaves on the planet and convert them to wage laborers. That the rise of the industrial culture, economic growth, required that transition from a backward form of labor exploitation he called slavery to modern forms of labor relations, the wage worker. And so economics forced its way into the historical discussion in respect of the transformation of the modern world. And therein we saw the relationship again between resilience, the resilience of the industrial culture, and its sustainability in terms of moving through time to improve living standards of citizens. But science did not end there. It proceeded to move through anthropology into eugenics, in which science was the basis on which the racial distinctions in the human family were made formal, and a new form of scientific understanding of race relations took to the center. And again, poverty was explained in most parts of the world in terms of culture, in terms of people who did not possess a culture of resilience, a culture of sustainability, and therefore the poverty they were experiencing on a global scale had little to do with the extractive sciences, economics, colonization, but more to do with the anthropological and cultural characteristics of native people on a global scale. In the case of the Caribbean, with hurricanes ravishing a region annually and taking tremendous tolls upon human life and the material environment, again, we have been forced to engage a scientific understanding that brings history, economics, and the environmental sciences together. The Caribbean, of course, is located in a space on this globe that does attract the ill winds of the earth on an annual basis. But when you examine who are the ones who are going to die from these hurricanes, then you enter into that relationship between economics and history. The truth of the matter is that the imperial and the colonial ruling classes that were able to construct their communities on a sustainable basis, where they built their houses on solid foundation, where they used stone and as the basis of construction, and they built an environment for themselves as an elite that could withstand the hurricanes on an annual basis. The working people, however, the vast majority of the workers, the poor people of African and Indian descent, who were forced by virtue of colonization to live in the valleys, to live in the river courses, to live on coastal environments, to live in environments forced to construct their homes and their villages in environments that were absolutely not ideal given the prevalence of hurricanes. And so annually, we see the hurricanes coming, and the vast majority of poor people living in little wooden houses, living in water courses, living on aspects of beachfronts that contain a tremendous amount of mud that is washed down on the coast by rivers. And this is where the majority of these people historically were forced to construct their communities, which made them extremely vulnerable. They were not sustainable. And hence the Caribbean is faced with a huge housing issue that had historically been framed by the results of colonization and racial domination. But it goes even further. The discourse the Caribbean is facing today around diabetes and the pandemic of other chronic diseases, the historians and the medical community are at variance. The historians are saying, well, you know, these working people have been forced for 300 years to work on sugar plantations. They were forced to consume what they were planting, what they were growing, eat what you grow. They were growing sugar. And as a result, you have millions of people in the Caribbean who are addicted to sugar for hundreds of years. The historians are able to show from the records the evidence of the pandemic of diabetes, type 2 diabetes especially, in the colonial period, on the sugar plantations, in the villages of slavery. The evidence is there. But yet we have a conversation in which the medic says, no, this diabetic pandemic is not the result of historical forces. It has more to do with the changing of diets in today's society, contemporary nutritional patterns in which people are eating sweet, refined sugars in their foods, the drinks that they consume, the beverages that they consume. So it's not historically rooted, it's more the result of a changing pattern of contemporary behavior. That conversation goes on, which suggests the need for an interface of historical sciences with medical sciences. But altogether, we see, even in the movement of viruses from their natural environments into the villages surrounding forests, rainforests, and the movement of viruses into the communities of the poor, which then devastate those communities, we can see the relationships again between economic development, the deforestation process that's taken place, the industrial and urban complex that is corroding the natural environment, releasing viruses and other pathogens into surrounding villages. All of this require an articulation of multiple disciplines if we wish to speak about sustainability and resilience. Universities around the world have a tremendous role to play. Many of them, for the first time in recent years, have been researching their own relationship to empire, because we know that much of the sciences that we had taken as hegemonic emerged out of these universities, especially traditional elite universities that preceded European colonization and thrive in the era of colonization and empire. Many of these universities are now revisiting the role that they have played in formulating concepts of economic development, social relations, ethnic relations, and recognizing that the culture of research which they have produced over the last 300 to 400 years is not sustainable in the context of contemporary conversations. And thus, universities are now re-examining their own pedagogical paths. They are examining the curriculum and the syllabuses that they have delivered in classrooms for hundreds of years. And now they are in a position to see the untold damage that they have done to the human family, largely as a result of the use of science as an instrument of colonization, an instrument of oppression and human differentiation. So now science in the university is faced with a reality of undoing much of the harm that they have done and forcing a new relationship between science, sustainability, and resilience. And finally, I would say some universities are owning up to the impact of their contribution to intellectual and academic teaching and learning. And while they are collecting a tremendous amount of research in respect of the impact of their sciences upon the world, society, and economy, many of them are not prepared to face up to the consequences of their contribution. So the notion of research and run has now become a feature of the Western academy. Research, understand the issues as they are, but the research findings do require a commitment to a concept of change, the concept of a sustainable future based on fundamental empirical evidence. So research and run is the most effective way to achieve non-sustainability. Those traditions might be resilient, and they are resilient, but they certainly are not sustainable. Colleagues, I thank you very much for the generosity of your attention. And I do hope that you have a wonderful conference and hope that some of these issues, these contradictory, discursive issues, will somewhere intervene in your deliberations. Thank you very much indeed.
very good morning, good afternoon, and good evening to all the participants of Commonwealth Science Conference. I am Chai Ching. You could call me just so I know that it probably could be quite a little bit difficult for people to pronounce my name. So I am from Kuala Lumpur, Malaysia. I'm a microbiologist and senior lecturer from the University of Malaya. Currently, I'm chairing the Young Scientist Network Academy of Sciences Malaysia, which serves as the National Young Academy of Malaysia. So thank you for having me here. So I'm so excited to be invited by the organizing committee to chair this very important and interesting panel discussion on developing and strengthening networks of early career researchers to address global development challenges. So as we know, the world is changing rapidly and we face various challenges, including the changing climates, the ever-increasing human population that has a great impact on environmental, energy, and food sustainability, as well as our health and wellness. So these challenges are growing and have been added to by the COVID-19 pandemic, which has affected early career researchers as well as international collaboration. Perhaps the silver lining of COVID-19 is that the pandemic actually brings science to the forefront, and the world now start to realize the importance to actually strengthen science and to support early career researchers. So in a way that it would ensure the sustainability of science, global science. So one of the main objectives of the Commonwealth Science Conference is on developing new networks of early career researchers to address global development challenges. The purpose of this panel discussion is actually to explore this in more detail and identify what is actually required to ensure that the next generation of researchers are empowered and equipped to collaboratively address these critical global challenges, such as climate change, biodiversity loss, and sustainable energy. So we are very delighted to be joined by a panel of some of the very active and influential early career researchers from across the Commonwealth, so who are leading or have led their national young academies and or convene prestigious research networks. So it is also our honor to have a perspective from a senior policymaker, Stuart Minchin, the Director General of the Pacific Community, here with us today. So how are we running this panel discussion? So first, each panelist will be given the floor to speak for 5 minutes each before we actually open up this general discussion for Q&A, in which we will actually select participants' questions from the online platform. So I'd like to urge all participants to actually grab this opportunity to engage with the panelists, so by submitting questions through the online platforms. So if you have any questions, so just type in. So please be reminded that also this session will be recorded, uploaded to the platform, and made available to watch on demand. So it is my honor right now to introduce to all of you the 4 panelists with us here today. So first, we have Dr. Lucy Stewart, so who is the co-chair of Royal Society of New Zealand. Lucy is a researcher and communicator whose work actually covers a variety of areas relating to the large-scale interactions of environmental systems. Then we have Carly Kehoe, who is the president of College of New Scholars, Artists and Scientists, Royal Society of Canada. So Carly was elected president of the Royal Society of Canada's College of New Scholars, Artists and Scientists in 2020, and also sits on the RSC's council. So her research focuses on religion, migration, and minority identities in the British Atlantic. She has a strong interest in sustainable development and rural change in Atlantic Canada and is a strong advocate of research-led public engagement. So welcome, Carly. And thirdly, in the panel, so we have Joannes Atela, who serves as a convener of Africa Research and Impact Network. So Joannes is Senior Research Fellow in Climate Resilient Economies at the African Center for Technology Studies. He has a breadth of interdisciplinary experience in environment, climate change, agriculture, and development. And he convenes the African Research and Impact Network, in short, ARIN, so which brings together scholars and policymakers from across Africa to address a wide range of sustainability challenges. So welcome, join us. And last but not least, so we have Stuart Minchin, so who is the Director General of Pacific Community. Stuart was appointed Director General of the Pacific Community, the main scientific and technical organization in the Pacific region, so in January 2020. Prior to that, he represented Australia in key international forums relating to environmental health, earth science issues. So, welcome, Stuart. I would like to start this discussion by asking our panelists here 3 major questions. So the first question, how has the COVID-19 pandemic impacted your research and international scientific collaboration in your field, in your country, probably also in your region? So then what are the 3 things, in your opinion, do early career researchers most need in order to mitigate these impacts and more effectively address global challenges through international as well as cross-disciplinary collaboration? And finally, who is best placed to provide this? How? And what is actually needed in order to actually persuade them to do so? So I would like to probably invite Lucy. Would you like to start first?
I'm very clever, so I know where the mute button is. As was mentioned, I am the outgoing co-chair of the Royal Society Te Pārangi's Early Career Researcher Forum, which is an organisation that seeks to support early career research issues within Aotearoa, New Zealand. In terms of what I do for a job, I work for a startup in the environmental finance space called Toha Foundry. And prior to that, for 4 years, I was at a government research institution called GNS Science. So I'm coming to ECR issues from an industry perspective rather than an academic one. In terms of the effect of COVID on my research and what's going on in New Zealand, we are in a very unique position in that it hasn't greatly affected what we're able to do within New Zealand because we had a brief lockdown last year, but other than that, we've been relatively back to quote unquote normal. But of course, our borders have been closed. Within New Zealand, we rely extensively on international collaboration for science. People are coming and going all the time. It is expected that most people will go overseas to do PhDs or postdocs before they return to be employed within New Zealand institutions. So it hasn't stopped science within New Zealand, but it has put a real cramp in early career researchers' careers to the extent that our government has actually had to put out a special funding pool for people who would have gone overseas to do postdoctoral fellowships and now no longer can do so, to support them to do fellowships within New Zealand over the next couple of years, just to make sure that they stay in research and their careers keep going. This speaks to, I think, one of the major issues for researchers in New Zealand, as it is an issue for early career researchers everywhere, which is the issue of long-term career development. Obviously, we have a lot of people coming out of university with PhDs, and if people want to stay in academic roles, not nearly as many academic roles as there are people with PhDs. And particularly in the New Zealand context, approximately half, I believe, of our university staff do come in from overseas, so it's extremely competitive to get a permanent position. I think the 3 things that early career researchers need most, firstly, more of this targeted government funding is really important. For a long time in our context, we had only 7 postdoctoral government fellowships a year for the whole country. So having the 30 more that they're funding because of COVID is a huge thing, but we still need more support than that. Secondly, ECRs really need more long-term career development support. My experience talking to people as a ECR rep and advocate is that people come out of their PhDs and they don't really know where they're going, and it often takes them a long time to figure out where they're going, especially when they have to think about moving overseas to do it. And the third thing, I think, is people need much better connections to research opportunities outside of academia, which obviously I would say is someone who's in industry. But really, the reality is that most people who go into even early career research as postdocs will not stay in academia. And there tends to be a gap where they are looking for what they're going to do to stay in research related things, but they don't know where to go. So I think what's really needed is we need active connections made between research opportunities outside academia and inside it, both internationally, across international borders and within countries. We need people who go into those industries to try and maintain those connections with academia and more industry-academia collaborations, which will give ECRs opportunities and show them all the possibilities that are available to people with research experience, rather than just being a professor. Not because that's not incredibly valuable, but because the reality is most ECRs will not become professors like me. They will do other things. And I think the way we have to do that is, firstly, ECRs do have the responsibility to do some active lobbying in this area. I'm really excited for what's going to happen in New Zealand because our new Associate Minister of Science is actually an early career researcher herself. She just finished her PhD 2 years ago. So getting that perspective into government is hugely valuable, but you can't rely on that. So you need to actively go out and explain what's needed. And we need universities to be willing to start making those connections and connecting their students and their postdoctoral fellows with those other opportunities. And I believe that's the end of my 5 minutes, so I will pass on to the next person.
Lucy. So this is a very interesting, point of view, in terms of long-term career development. So perhaps, in Malaysia, we are facing also the similar problem as you are facing right now. So could we have Carly? Carly, could you share your points of view, what you have observed in Canada?
Yeah, thank you very much for that, Chai. And I agree with a lot of what Lucy was talking about. A couple of other things that I would add, and this is, I'm speaking from the Canadian perspective, but also from a broader perspective, because in addition to my role with the Royal Society of Canada, I was also a member of the Global Young Academy, and I'm an alumna of that. So, I've been hearing things from a range of people. One problem that's becoming very, very clear is the major gender imbalance. Women have had to take on enormous care responsibilities in addition to what they already do in terms of their academic research. But at home during the pandemic, they have had huge weights on their shoulder. And what we're noticing is that the publications, the projects, all of those, we are seeing a big difference between men and women in the research area. I've heard of entire research projects being canceled. PhD students, their futures are thrown into doubt because they couldn't complete the final stages of their projects. Similar thing with postdocs, where a postdoc has been delayed or it wasn't even allowed to start and canceled before they could even get their foot in the door. That's really, really difficult for early career researchers. What this has done, and not just for the PhDs and postdocs and early careers, but mid-career people as well, there's been a massive slowdown in discovery or fundamental research because people can't start the projects. I'm in the arts and humanities, so instead of a lab, I have libraries and archives, and I'm required to travel, and people in that situation haven't been able to do any of that. So the discovery research has really suffered. There's also the fact of mental health problems and exhaustion as people are trying to juggle so many things and share space with family members or friends or roommates that they're not used to sharing space with as often. And like Lucy said, there's very serious precarity on the job market now. A lot of governments, universities are struggling with much reduced budgets, as though they weren't reduced before, but much reduced budgets. And so there are fewer opportunities coming up. And that, I think, links with Lucy's broader point about us needing to do more to demonstrate the value of industry. And, a PhD doesn't just have to be for becoming a professor. There's tremendous skill involved in that. And how can we share that out a little bit more? In terms of things that are needed to mitigate this, I gave some thought to this. I think there needs to be some dedicated funding help to get people moving again once people can be moving again. And I would quite like to see the beginning of a global congress for early career, mid-career researchers for the Commonwealth area. And I would include all science, which means social sciences, arts and humanities, as well as the pure and applied sciences, so we can all talk and learn from each other. That is really important. We're not going to solve the problems that we're facing in silos. I also think it would be useful if there could be some kind of dedicated support or funding for women to help them catch up or get back the footing that they had lost because of the pandemic. It is very, very serious, and I'm stressing this because I'm hearing it from all angles. We are facing big problems here for dealing with research equity. It would also be nice if there was a joint statement from the senior societies, the senior science academies, that help to develop some kind of action plan about the value that they place on early career researchers, and then how they are going to help and support us getting back on track. I think this would be really, really valuable, and collective action, you achieve more when you have a united voice. Then in terms of who could be advocates for this, obviously the early and mid-career researchers, we need to do this for ourselves, but what I also think is really important are the national ministers of science or the chief science advisors for various countries speaking out about this, flagging it as an issue, so that the national research councils kind of, they do engage with it and they do find mechanisms to support people, because this is the research talent of the next generation, the ones that are going to take our countries and nations forward. And I'm nervous about the loss of this. And also, many of us work at universities. The universities, I would be very keen for them to be active in speaking about this, finding opportunities where they can to support early career researchers. And then, of course, senior science academies like the Royal Society, like the Royal Society of Canada, for example, providing platforms like this to bring people together, to talk about challenges, and also to help us understand we have some very common themes that run throughout our countries and our national research agendas. But those were some of the thoughts that I had about COVID-19 and how it's affecting all of us. Thank you.
Yeah. Thank you, Carly. So I think you bring up a very interesting point, on the support of senior academies in terms of, collaboration and how the entire academy actually, support and help each other. So I think this is one of the models, that perhaps, later on, if time permits, we could go a little bit more deeper, onto the topic. So I think the gender differences or imbalance is always, one of the issue that that the scientists face, I think this is particularly more serious, in the early career researchers. So perhaps, we could talk a little bit more about it later on. I would like to invite Joanna, could you share what you have seen in Africa? So are you facing the similar challenges over there?
All right, thank you so much. I think COVID-19 is a global challenge, so certainly some of the challenges that my colleagues have highlighted are also applicable to Africa. I convene a network called the Africa Research and Impact Network, which brings together a number of early career researchers to be able and sort of dialogue on best research and impact practices. We have over 80 fellows across Africa, and these fellows are both researchers and policy makers. So last year we convened the first international conference on COVID-19 and the impacts that the COVID-19 have on Africa's research and policy trajectories. In terms of the challenges, as I've said, COVID-19 is a global issue. And for Africa, I think the challenges are the same, but relatively severe, simply because Africa's research depends on international support. African countries have only about 1 to 2% of their GDPs invested. And that means that the research systems within Africa are really dependent on international funding. So with the COVID, there are a number of severities, which of course align to what my colleagues have said in terms of cutting off research operations, because certain activities, perhaps have been delayed, and because of such delays, engagement, collaborative, even that early career researchers involved in are sort of cut off. Some of the projects have to be terminated, and some of the donors had to review their circular topics to sort of shift funding towards COVID, and all that in a way, in one way or the other, has really cut the process of engagement, especially for the early career researchers who have been really relying on this particular collaboration. So in a way, the momentum that had been built over the years in terms of trying to build niches, trying to build capabilities of early career researchers within the continent had to be cut short. I think the other thing is the element of the contextual, linkage with the research, because within Africa, one of the niches of the early career researchers is the fact that they're able to go into the practice and understand the context working on the ground. And that empirical part of the research has been kind of affected quite significantly with COVID. So there is that disjoint between what on the ground in terms of what the early career researchers are able in terms of evidence that then inform broader level theories. So that particular momentum and integration of evidence of the ground and the context within which the early career researchers work has been affected. But I want to deviate a bit from the challenges, because I think COVID has also presented a number of opportunities to early career researchers. One of those opportunities is the fact that COVID has offered the early career researchers an opportunity to be able to understand the changing nature of the global challenge, be able to see how best they can position themselves to be able to address these particular challenges. COVID was not actually anticipated as such, but certainly with its coming, with the changes in the global sort of processes, most early career researchers within Africa have been actually been keen to understand, or have been pushed to now start thinking much more proactively about the challenges that the continent could face, and the changing nature of disasters and ways in which preparedness could be built better, and also bringing out the element of the approaches to disaster risk management that is common in most African contexts. So we see early career researchers really understanding and unpacking some of these challenges and positioning themselves better to be able to tackle or deal with some of the future that could come into play. That is also the basis upon which they work also engaged with the COVID the global stakeholders on the COVID situation, so that the lessons that COVID present as going to pass by as count back to recovery, and we have with large economies, but we are able to really say that this is an opportunity to learn and see what needs to be done, and the role of early career researchers, and especially looking at COVID, the role of early career researchers in building really local systems to be able to respond to this disasters is very critical, because COVID actually made most of the countries to close their borders. There were no travels and all that. So most of the African countries were kind of forced to look inside in terms of what is it that is existing our system. What are the local innovations? And during the Arena International Conference on COVID and lessons that was held last year, one of the key things that came out strongly is the element of building local systems, local capabilities, local innovation systems that are able to respond to some of these really globally driven disasters, but really with localized severe impact. So the early career researchers have basically seen that space as a way of building a more bottom-up research and policy impact systems. In terms of what the early career researchers would need in order to really address these challenges. I think that the main three things I would say, some of which have been highlighted. Number one is there's need for close working relationship between early career researchers. I think early career researchers are really having a great opportunity. For instance, if I talk about Africa, to transform the African continent. We are talking about a continent where the majority of the population are the youth. And certainly, their role in terms of being able to take research leadership and being able to propel this to the global level is very, very critical. And for that to happen, there'll be need for sustained engagements. A lot of the engagements within the early career researchers network have always been project-based. So when projects that support such engagements end, then such networks kind of die. So we need to, have a more sustained approach to having that particular the engagements to make them more fruitful. But also the other thing is that there's need to rethink really the early career research networks. What are they for? What is it that we need to achieve with these networks? I mean, are they just networks that are being formed to be there so that we have a network of people coming together? What is the difference with the kind of community of practices that we hear, in every part of the world? What is the value that early career researchers can build? I think this is a major question that calls for what I would call steering the strategic values of early career researchers towards strengthening, clear niches and capabilities to be able to maximize or, address the challenges within the society in a much more optimal way. So the vision and the mission and the strategic value of these particular networks need to be well rethought. And most importantly, I think the early career research also needs what I would call the graduation structures. I think there is a possibility that a lot of early career researchers can be called early career researchers forever. And you end up suffering what I would call the early career researcher fatigue, where you are early career researchers. But we don't see these researchers basically taking responsibility. So we need to see a lot of space being created for the early career researchers to be able to make decisions and to be able to develop their management skills beyond just being called, the early career research. So exactly what can early researchers contribute to the society? What solutions can they make? Can they be entrusted or entrusted leadership positions? Can they be with the research PIs? I know a lot of donors are always very focused on really established researchers and very clear plans of action and ensuring that the projects that are funded are delivered. But certainly, can we reflect a bit and try to think about the role that early career researchers can play such leadership, but also in terms of informing them? In that way, I think there will be a much more enhanced role of these particular networks in responding to the societal challenges that are happening now, but also into the future. Finally, in terms of who could do this, I think I do agree with a number of comments made by my colleagues. The need for affirmative action from governments and from donors to be able to support these networks is very critical. And one of the proposals I'll make here is that there's need for specialized budget allocation that could support networks. And these budget allocations or budget lines could actually be mainstreamed within relatively larger projects so that the elements of the strategic value and functionalities of the early career researchers are well mainstreamed within major programs. So kind of decision-making roles and managerial roles that I was talking about could really grow very organic way for the early career researchers. But also I think, as I've mentioned, the research systems within our countries need to provide programs that really usher in researchers into the decision-making space. And finally, I think there's a lot of good work done by the early career research networks. And certainly one of the key limitations is that this good work, are always not well in terms of, showcasing the best practices to the world, so that they can be exposed to better opportunities and contribute information that can be used for learning in different contexts. So that would be very important if we have to see who or bring in stakeholders and actors like the private sector, the donors, to be able to see what is happening within these particular networks and be able to support them accordingly. Thank you very much. I hope I haven't gone beyond my time, or I've surpassed briefly. Thanks.
Thank you, Joanne, for very, very insightful opinions, or point of views on all of the topic that has been mentioned. So I think, you have raised a very good point. Also, in terms of, the COVID-19, indeed, it really opened eyes, for all the young researchers, the early career researchers, not just early career researchers, but also the government and also the researchers, the research community in particular, that we need a localized action. We need to start to look into the talent development in our own region, country, and from there we can work beyond each country, where we start to look into global collaboration and how we should do that. So how we could have a more sustainable early career researchers network where we have doable action plan that will impact early career researchers. So I would like now to move on to Stuart. Stuart, so as a policymaker and user of research, so what would your opinions about, the three main things the policymakers think that the early career researchers must have or need?
Thanks very much. So first up, I'm not sure I like being called senior. I still think of myself as a recently graduated researcher, and think of myself as much younger than I actually am. So first up, on the COVID situation, I started my role at the Pacific community only just over a year ago. So I stepped into this role just in time for COVID-19, and have learned a lot about crisis management since then. One of the big impacts in our region of COVID, we've been very lucky to escape serious health across most of our countries, although Guam and French Polynesia have suffered significantly. But most of our countries have kept COVID out by shutting their borders. That's had some real implications, though, in that it stopped the travel of all of our staff, our international staff, our researchers in the region that would normally be travelling amongst the Pacific countries to do their work and to undertake their research. Many of our international researchers, if you like, come to the Pacific from all around the world to do their research and to assist the region in its development challenges. But they were viewing that as a great adventure, and they now have spent a year cut off from seeing their families. My family, for example, is still in, and I haven't seen them for over a year because of the reduced travel options in the region. So that's having a big impact. COVID has had some, while it's reduced options for physical connection, it's really enabled a new world of virtual connection, as we're doing here on this panel. So every challenge is an opportunity, and I see the relative comfort with technology that many early career researchers has a real advantage in at the moment in this new world where we have to lean on technology to deliver. So many of our team are developing new ways of working remotely, utilising local people on the ground to do some of the legwork that they would have alternatively done themselves, and having to find new ways to work. There was a mention earlier of the disproportionate impact of the crisis on women and other marginalised groups. So I'm going to come at this from a I guess a user of the output from early career researchers and thinking generally about what's needed from you as early career researchers. So The first one, which relates to that line, is I want you to aim late career researchers or research leaders in the future, particularly if you're a woman, LGBTI, or from some other marginalised group. Science thrives on diversity of thought, and we need you in the science community to strengthen our diversity of thought. And one of the strategies you think about is moving quicker into research leadership than you otherwise would. I think all researchers go through a point in their career where they realise they can achieve more through leading others in their research than they can themselves on the lab bench or doing the work themselves. Some people reach that point very early in their career, as I did, and some people reach the end of their career. But that's a great opportunity. There are different models that you can use for advancing in science that don't necessarily only rely on publish or perish and a professorship. There are different pathways you can take to have real impact. Second big point: think big, think broad, cross boundaries, and collaborate. Be ambitious about what you can achieve from your perspective in change. Not ambitious for your own career necessarily, but ambitious for the change that you can create. You can do that many different ways. It's not just the traditional career path of PhD, postdoc, postdoctoral fellow, and then you retire. So many of the people that I know that are successful and impactful in science have taken completely different pathways to that. And this is an alternative way of thinking about how you can achieve things. Science is often about the search for truth and certainty, but you need to become comfortable with ambiguity and particularly when you're dealing with human systems. Governments, universities, agencies, policy is all about human systems where people don't behave in well-ordered ways. So I think the key is recognising that at times of crisis and change, like we face at the moment, it offers as many opportunities as it does challenges. And the people that thrive in the situation, the people that have long and or successful careers are the ones that find the opportunities, not the ones that perceive the challenges. So I'll leave you with that. Back to you, team. Thanks.
Thank you, Stuart. So what a good point. I actually like what you say, think big and think broad, and do not just think about your career path, as a conventional or traditional one that you need to start, from postdoctoral fellow and retired after that. I think as early career researchers or as someone young with very passionate heart, so you need to think out of the box, thinking of the way where you can progress yourself and create the opportunity yourself. So I think that is a good one, for all of us to reflect and to think about it, the way to move forward. So right now, I would like to go into the general session right now to discuss about, the Q&A session, where we do have a long list of questions over here. That let me look at it. So we have the first question over here posed to Carly. So, Kali, the question is about, you talk about the humanities, sciences, and things like that. So, the question over here is that how to create opportunity for scientists and I think humanities, scientists, to come together on collective research. So, how we could actually, what is important from a policy standpoint? So, especially in light of conference theme in building a resilience future. So that's the questions.
So I saw that question come in and I just jotted down a few points. And I just have two, because I know that there are a lot of people who have things to say, but a couple of things that I thought would be immediately helpful is if there are congresses or large meetings, I would encourage themed panels where there's a requirement for people from different disciplines to come and speak on a particular theme, such as migration. That actually wasn't highlighted, but should be highlighted. Climate change, sustainability. These are all themes that a wide range of researchers can speak to. So I think that if we encouraged interdisciplinary panels, that would be one way to bring people together to start generating ideas. Because I agree with Stuart's point about science actually thrives in diversity. And until we start talking to people, we're not going to have answers, really. I also think if there were funding streams that were introduced that required not just interdisciplinary input, so people don't even qualify if they're all from the same tribe. I think that was the term that was used in the question. But funding streams that require interdisciplinarity, but also international input. So you have teams of researchers that are coming from different backgrounds, putting in a funding bid for a project on, say, climate change or migration or something like that. Those are two practical things that I think would have significant mileage and we would actually benefit from in big ways.
Thank you, Carly. So I myself have some experience working on cross-disciplinary research. So in your opinion, do you think that there is different like normal way of doing things in different disciplines, and how early career researchers, what skills early career researchers should have when they come into a cross-disciplinary research, particularly when we talk about the so-called hardcore science and humanity science.
Yeah. It's important just to, talking cross disciplines can be really difficult as well. So we need to give each other space so that we learn how we think and then, just see what comes out of that. That's discovery research. That's fundamental research.
It's always a big knowledge when we talk about collaborative science, collaborative research, and cutting across different culture, different disciplines. So we have the second questions over here. How do we encourage early career researchers to break down silos between disciplines when so many supervisors and professors actually push the early career researchers to decide on a single specialism to pursue? Lucy, would you be able to address this?
Yeah. So I've done a lot of interdisciplinary research in my life in areas. I've worked in deep sea research where you can't not do interdisciplinary work because it costs $50,000 a day to have a boat at sea. So you need people from all sorts of areas out there. And I think the key thing for early career researchers getting involved in that, if they have supervisors who aren't interested in them doing that, is firstly pressure needs to be put on supervisors to encourage SCRs to get involved in this interdisciplinary work. Secondly, there needs to be targeted funding that actually supports people to do that work specifically. And thirdly, a thing that is really helpful is interdisciplinary conferences and networking opportunities. So it needs to be a combination of SCRs being supported to move out of those silos, of established researchers being encouraged to support them to do that, and the opportunities created for people to mix. Because I really do feel we are in a world now where I don't think you can succeed without doing some sort of interdisciplinary research, but early career researchers are often expected to kind of be the workhorses and get the work done and not be thinking so much about those big connections. And you have to reach out and start doing that thinking. You can't wait for someone to approve it and to tell you it's okay to do it. You've just got to get out there, is my main thought.
Yeah, I do agree that we really need everyone to work together to break these silos. So it's not a problem that a single country is facing. I guess it's a global thing that is happening. So, but yeah, nowadays the transdisciplinary research, and it's all about collaboration. So, I mean, that's the world today. Perhaps, when we look at, the COVID-19, the development of vaccine, it clearly, demonstrates the need to have collaboration in research. So silo works, doesn't produce, any impactful research, perhaps, nowadays. So we have another question from Orna Bixby over here. How do we best mitigate existing inequalities? So the particular impact, that impact women and more so Black women. So both at the systemic level and individual level as senior and early career researchers. So perhaps who would like to take these questions? Joanna's probably
I can say
take this
Oh,
question.
sorry.
Sure, yeah, probably. Yes, please. Was it Carly?
Yeah, I didn't mean to interrupt, but I had flagged the inequities with women. One thing that we need to do is actually keep saying that there are inequalities. And I take Stuart's point about the need to kind of consider research leadership and moving beyond the publish or perish. But when you're at the early career research stage and even mid-career, promotion actually depends on grant income and publications. And so I think we need to recognize how we can implement support structures to say, we recognize that you've got a lot on your shoulders, that you might be dealing with an awful lot more than somebody else. How can we empower you, or how can we provide support structures to recognize that? And then I think once they start moving up, then we can move into research leadership roles. One thing that also would be very helpful in terms of mitigating the inequities is to have really strong mentorship programs, not just at the university levels, but we're all representing societies, senior academies, and there's a wealth of skill and expertise in those bodies. And I would certainly like to see more mentorship happening from people who have managed to crack that glass ceiling or smash it, and talking to people like me and colleagues about how they did it. And I think that would be very meaningful and practical.
Yeah, thank you, Carly. So, Joanna, do you have anything to add on to these questions?
That's the question. I think it's been addressed effectively. Maybe just to add that we really, and this is a problem or a question I always pose whenever I engage with the gender discussions and dialogues, because there is this continuous talk about women, want days, women or men, and all that. But the question I always pose to people is: do we really know what women want, or do we really have evidence in terms of these clear inequalities and what these inequalities mean for the women, in a way that can help us make really very strategic decisions or strategic action agenda that could address those particular inequalities? Because certainly, even within the world of gender, you look at women, there's a lot of differences. There is, and different categories of women. And, understanding this is certainly something that, has not been, if I speak from the African context, has not been well understood in terms of the different groups of gender, the different groups of women. What is it that they would like to see? What is it that they want to see in terms of ensuring that their needs are well mainstreamed in this particular perspectives? Otherwise, I totally agree with some of the way forwards that have been put forward by my colleagues, but I think that should build on an evidence base on trying to understand really what do women or what do men want, or what are these inequalities.
Okay. Yeah. Is there any would you be able to share with us is there any initiative that is ongoing or available in Africa that engage early career researcher diaspora? Joannes?
Yeah, thank you. I think just to start with is to say the diaspora early career researchers are a huge or a wealth of knowledge or a wealth of skills for the African development. And if you look at the Africa Agenda 2063, the diaspora skills is one of the targeted skills that could really help to actualize that particular agenda. There has been a number of platforms that have tried to engage these researchers. And some of these platforms are basically built on research collaborations, project collaborations that are being pursued. But certainly there are also platforms that are built around learning and trying just to bring the early career researchers in the diaspora together to link with the continent. I know of quite a number which I can be able to share with you, but one of the things I would like to mention is that a number of these platforms not being able to sustain the process of strategic engagement with the diasporan earlier researchers simply because of the engagements are more about are not sustainable. They are more about texts that are perhaps being implemented, which is a good starting point. But certainly there will be need to start thinking about how do we, harness the outcomes and the learnings of the research projects that are being undertaken to be able to create a stronger connections between the early career researchers at the diaspora and the processes within the continent. What we've tried to do as RIN to address this, that there is an impact network, and I'll reach out to you to be able to so now we can engage, is to really create a diaspora point. I think it's based in Australia. And he is actually trying to mobilize diaspora and early career researchers and bringing them into the dialogue table with the African regional dialogues that we undertake on research practices and with the aim of trying to identify the research gaps within the continent and what needs to be done and how we can do a much more collective way. So that is a way that we can start building the momentum towards a more sustained engagement of the diaspora and early career researchers. But we can engage more in the session. Thank you.
Yeah, thank you, Joannes. Stuart, so I have a question over here, that deal with policy. So there's been a lot of training that is going on nowadays for early career researchers on science, advice, and diplomacy. So in particular, also science communication, how to communicate with the different stakeholders for early career researchers. So this has been highlighted as part of the training that is actually required by early career researchers nowadays. So as a policymaker, so in your point of view, so how is there any platform available or initiative on how to build connection with policymakers and to communicate and work together with policymakers?
What I'd say is that your academic qualifications are often your ticket to ride in a career, but how far you go in that career is very much determined by your soft skills, your ability to communicate, to empathise, to work with others, to influence people. And I think it's something that's underdone in general in our education of early career researchers, that the critical importance of communication skills, presentation skills, and being able to talk about your science in ways that a layperson can understand should not be underestimated. It's probably going to be the thing that determines how far your career goes and how quickly it goes. So I think it's really important to support this with early career researchers, those skills. I think it's really to underestimate the impact of having strong communication and presentation skills, but it is absolutely critical. I can say in my own career, I've not had a my academic record is patchy at best, but I've gone a long way in my career, and a lot of it is down to those soft skills, the ability to communicate with policymakers and talk about things in ways that not down, it's actually being clear and concise about the message across. Back to you.
Okay, thank you. So I would like to take this last question over here before we conclude and make a summary. Is that, Stuart, this question probably you will be more suitable to answer. This is, how can governments and local institutions, especially in developing countries, be encouraged to support early career researchers' career progression?
Look, great question. I think making use of tools like graduate recruitment programs where you're deliberately going out and looking for people that have only been out of their training for 2 or 3 years is an example. We used to, in one of my parts, we had a program like that was really aiming at just postdoc kind of period in terms of bringing them into the organisation at that point in time. Recognising that early in people's career they haven't built these soft skills necessarily, they haven't had experience at managing people, and supporting them through leadership development. Leadership is a skill that you learn. It's not something we're born with. So, spending time not just using early career researchers as the engine room and focusing them, as a few of the other questions said, on delivering, a specific piece of research, but viewing yourself and your organisation as a talent factory. Everyone who leaves your organisation, you should celebrate, and they should go away feeling like they were supported in taking the next step in their career. Not that they were used up and spat out. So I think if organisations can start thinking about early career as people that are with them for a short period potentially, as long as you make sure that they leave the organisation better off than they joined the organisation, I think we'll go a long way to supporting people in navigating their own careers. Back to you.
Thank you, Stuart, and thank you all. So how I wish that we could have more time, to look into all the questions and to discuss further. So let me try to summarize the discussion. So we have actually looked into all the challenges the early career researchers face, and all of these, we talk about there is a lack of clear career path, a long-term career path that the early career researchers could take on. There has been a lot of challenges, for early career researchers to move on. So perhaps, one of the way to look into it is to really think out of the box. The early career researchers need to create opportunity and need to speak for themselves. So need to work together to create that opportunity, a different future for the entire research community over here. So again and again, we heard about the term funding. There's not enough research funding. So yeah, it will never be enough for research funding. So there has been a lot of challenges to look for research funding. Is probably not just in the developing country, but I guess in developed country, all the researchers are facing the same problem to fight for that research funding, and probably not just the research funding, but the area in which these research funding are focusing on. So what are the challenges that we should look into is international or local challenges. And of course, we can't run away from gender differences or imbalance in scientific field. So there is still a lot more that we need to work on to fight for not just probably gender, but also marginalized population. So there is a lack of support for early career researchers, and this support perhaps we need to look from government, early career researchers to support each other, of course, and also to have from the senior academies. And probably I would just like to add one more that Stuart has mentioned, like, several times on leadership training. So there is a need, like, for leadership training for early career researchers. And of course, like, the definition of leadership, what is a leaders in science community, what is considered as successful researchers or scientists. We probably need a little bit more time to reflect on it and to discuss and to get away, like, what type of trainings we actually need in this process. Okay, so that's a little bit that we have discussed, like, over the 60 minutes. So I really wish that we have more time for that. So thank you so much, like, for our very insightful panelists, and looking forward to seeing all of you, like, in the coffee sessions. So I know that, like, in this tab, we actually have the coffee session where we could engage further and talk more. So perhaps we could continue the discussion over there. So with that, so thank you and see you. Have a good day.